What is alcoholic hepatitis? Alcoholic hepatitis is the swelling, or inflammation, of the liver caused by drinking alcohol. Alcohol destroys liver cells. Alcoholic hepatitis is most common in people who have been drinking heavily for many years. However, the relationship between drinking and alcoholic hepatitis is not straightforward. Not all heavy drinkers develop alcoholic hepatitis. Some people who drink very little develop the disease. If you are diagnosed with alcoholic hepatitis, you must discontinue drinking alcohol. People who continue to drink alcohol face a high risk of serious liver damage and death. What are the symptoms? The most common symptom of alcoholic hepatitis is yellowing of the skin and whites of the eyes, known as jaundice. Yellowing of the skin may be less visible on black and brown people. Other symptoms include loss of appetite, nausea and vomiting, belly tenderness, low-grade fever, fatigue and weakness. People with alcoholic hepatitis are often malnourished. Drinking copious amounts of alcohol keeps people from becoming hungry. And heavy drinkers get the majority of their calories from alcohol. Severe alcoholic hepatitis can also cause fluid buildup in the abdomen, known as ascites. Toxin buildup causes confusion and unusual behavior. The healthy liver breaks down and eliminates these toxins. Kidney and liver failure. What are the causes? Drinking alcohol causes liver damage, which leads to alcoholic hepatitis. It is unclear how alcohol damages the liver and why this occurs only in heavy drinkers. These factors are known to play a role in alcoholic hepatitis. The body's process of breaking down alcohol produces highly toxic chemicals. These chemicals cause swelling, or inflammation, which destroys liver cells. Scars eventually replace healthy liver tissue. This prevents the liver from working properly. Cirrhosis is an irreversible scarring condition. This is the final stage of alcoholic liver disease. Alcoholic hepatitis can also be caused by other liver diseases. Alcoholic hepatitis can exacerbate chronic liver diseases. For example, if you have hepatitis C and drink even a little, you are more likely to develop liver scarring than if you do not drink. A lack of nutrition. Many people who drink excessively do not consume enough nutrients because they eat poorly. And alcohol prevents the body from using nutrients properly. A lack of nutrients can harm liver cells. What are the risk factors? The most significant risk factor for alcoholic hepatitis is the amount of alcohol consumed. It is not known how much alcohol is required to cause alcoholic hepatitis. Most people with this condition have consumed at least 7 drinks per day for 20 years or more. This could be 7 glasses of wine, 7 beers, or 7 shots of spirits. Sex. Women appear to have a higher risk of developing alcoholic hepatitis. That could be due to how alcohol breaks down in women's bodies. Obesity. Heavy drinkers who are overweight may be more likely to develop alcoholic hepatitis. And they may be more likely to get liver scarring. Genes. According to studies, genes may play a role in alcohol-induced liver disease. Race and ethnicity. Black and Hispanic people may be more likely to develop alcoholic hepatitis. Binge drinking. Having 5 or more drinks in 2 hours for men and 4 or more for women may increase the risk of developing alcoholic hepatitis. What are the complications? Alcoholic hepatitis complications are caused by scar tissue in the liver. Scar tissue can reduce blood flow through the liver. This can increase pressure in a major blood vessel known as the portal vein, causing a buildup of toxins. Complications include varices, enlarged veins. Blood that cannot flow freely through the portal vein can back up into other blood vessels in the stomach, as well as the esophagus, which is the tube that transports food from the throat to the stomach. These blood vessels' walls are thin. If they are overfilled with blood, they will most likely bleed. Heavy bleeding in the upper stomach or esophagus is life-threatening and should be treated immediately. Ascites, pronounced ascites. Fluid that accumulates in the abdomen may become infected and require antibiotic treatment. Ascites is not life-threatening. However, it most often refers to advanced alcoholic hepatitis or cirrhosis. Hepatic encephalopathy. It is the combination of confusion, drowsiness, and slurred speech. A damaged liver has difficulty eliminating toxins from the body. The accumulation of toxins can harm the brain. Severe hepatic encephalopathy can result in a coma. Kidney failure. A damaged liver can disrupt blood flow to the kidneys. This can harm your kidneys. Cirrhosis. The scarring of the liver can result in liver failure. How alcoholic hepatitis be prevented? To lower your risk of alcoholic hepatitis, consider drinking alcohol in moderation or not at all. For healthy adults, moderate drinking is defined as 1 drink per day for women and 2 drinks per day for men. The only way to avoid alcoholic hepatitis is to abstain from all alcohol. Protect yourself from hepatitis C. Hepatitis C is a viral-caused liver disease. Without treatment, it can progress to cirrhosis. If you have hepatitis C and drink alcohol, you are much more likely to develop cirrhosis than if you don't drink. When to visit a doctor? Alcoholic hepatitis is a serious and often fatal disease. See a healthcare professional if you experience symptoms of alcoholic hepatitis. You cannot control your drinking. You want help cutting back on your drinking. Disclaimer. This video contains general information and discussions on health and related topics. The information and other content in the video, as well as the linked materials, are not intended to be used as a substitute for medical advice, diagnosis, or treatment. Please consult your doctor before beginning a new medication or health regimen.